Welcome everyone to our last but not least educational webinar for 2025. We'll be taking a deeper look at how two very different organizations have approached their MBC implementation journeys and what they learned along the way.
We wanted to build a program that was able to identify patients with behavioral health needs at every entry point into our care system. And we wanted to be able to integrate measurement-based care, to be able to drive continuous engagement and understand why our members maybe were disengaging from care and really understand how we could wrap around patients to better support them.
So it was really like, what is the puzzle piece we're missing? It is shown that measurement-based care can cut treatment dropout by up to 50%. They're also 2.5 times more likely to improve when the therapist receives regular feedback. Measurement-based care didn't just complete our puzzle, it brought the whole picture into focus.
Be able to see not only how they're progressing in terms of their outcomes, but how they've remained engaged in care. This allows us to tell a story to investors, to health plans, about how our model is impacting patients, not only in behavioral health, but social care and medical care.
So of course, client care first. And so it helps us to inform treatment planning and effective client care and keep goals on track and all of that. And then secondary to that, it really helps us to continue to build and grow and show the community what we're doing.
The very first decision that we made was that we were going to have universal screening. What that means basically is that every patient entering Zócalo Health is screened using the same standardized tool. Assessments are embedded into intake and follow-up workflows, so they happen automatically and not based on clinician discretion. A tool like Greenspace allows you to see how clinicians are engaging with a platform.
We frame it more as a clinical tool than a compliance metric. I can see on the back end, as Sophia mentioned, when people are logging in, if they're consistent and all of that, so we can address challenges as they come up. And then we also focus on interpreting trends, decision-making, how do we really use these to then move forward versus something we just do to check off the box.
We review our dashboards with measurement-based care, and we really look at patients who have deteriorating or stagnation trends and support clinicians making changes to the patient's treatment plan to better support them. The dashboard also allows you to see the patients that have been progressing and making changes over time, and that's a huge positive reinforcement. We want to be able to look at our registry or patient panel and say, hey, the work that you're doing is impactful, your patients are improving. When you set it up in this way, you get buy-in. They get excited because they know that they're signing up for something that maybe is new to them, but they have guardrails and support to make them feel confident in being measurement-based care experts.
I don't know if there are any other assessment or data nerds out there, but when I first saw all the options in Greenspace, I was in assessment heaven, just looking at all the things you can do. And it can be I could pull that, I could pull that, I could pull that.
There's gonna be the assessment battery that you use to track outcomes at an organization level. And then you have this amazing tool that you're bringing into your organization that your clinicians can use to really enhance their work.
It has been such a pleasure working with you both. Thank you, Sophia and Emily, for being a part of this work. Stay tuned. We'll be announcing our next session soon. And in the meantime, I hope everyone has a really happy holiday.